Good afternoon. I want to thank you all for being here. I'm joined today by the Secretary of Health, Kim Malsom-Risden, and I wanted to give you quick updates before I open it up to questions. Yesterday, we had a conference call with the President and the Vice President and the First Lady, Melania Trump. We talked extensively about children and how they're being impacted by this virus, and their lives have dramatically changed, and resources that the federal government was going to make available to the states and local cities to respond to child welfare situations. It particularly focused on mental health and making sure that we were able to respond in creative ways using telemedicine, mental health facilities, and technologies in order to respond to what families and children might be dealing with in the situation that we're currently in. The Department of Social Services announced today that there's $9 million in CARES Act funding for the state of South Dakota through that department. This will help us support state-licensed and registered child care programs and families with the challenges that are created by the coronavirus pandemic. And information related to that will be added to the covid.sd.gov website. May is National Foster Care Month. This is an issue that you all know I'm pretty passionate about, and recognize that so many families have stepped up in recent days to become foster parents, to undergo the training, and it's always good to draw attention to those that need a safe place to go when their family is in crisis. So if that's something you or your family is being led to do, boy, just reach out to my office and we'll help facilitate connecting you with those that can get you trained and help you open up your home to love on a child. We also have recently, in the last couple of days, facilitated calls with all of our mayors in the state of South Dakota and with county officials. We've been walking them through funding, about the $1.2 billion that has come to the state of South Dakota, that clearly the guidance from Treasury has said the state of South Dakota could utilize on its own. I have made the decision, though, that I will allocate some of that funding to cities and counties. And so we were talking through what some of the reimbursable expenses might be that they should be tracking so that they would be eligible for future reimbursement from the state of South Dakota. We will continue to have Liza with our Bureau of Finance and Management follow up with county auditors and also with city finance officers to get them all the details that they need to make the best decisions to respond to protect people in this COVID-19 pandemic, but also to make sure that we have transparency in the process and accountability to the guidance the federal government has given us. I want to touch on the situation we know we have in western South Dakota and Black Hawk. There's been a lot of questions to me in my office about what is going on there with the homes and the families that are affected by the mine that is underneath that neighborhood, but also what role the state has in this situation. So I'm going to be hosting a conference call with these residents that are directly impacted, and I'll follow up with you and let you know how that conversation goes. I think they've got a lot of questions and information, and I wanted to make sure we opened the lines of communication and could visit with them. Now, 3 weeks ago, we announced in South Dakota our Back to Normal plan. At the moment, we're pleased with where things are, although we're continuing to watch every county, every city, and making sure that we're addressing different positive cases and hospitalizations as need be. So some of the facts that are incredibly important to keep our eyes on is that our hospitalization rates remain stable. Our current cases, the active cases of positive COVID-19 folks that are impacted, are declining. And we may see another spike, though, with all the mass testing that we have going on and that we're doing. But again, our entire plan, our projections, and modeling was based on hospitalization rates, and we're in a very good spot as far as that goes today. So thank you all so much for continuing to social distance, for making sure that you're washing your hands and that the vulnerable population is protected. We have to maintain that for quite some time yet, and remember, this is a marathon, not a sprint. So we still need to keep group sizes small and make sure that we're protecting those who have health conditions that might put them at bigger risk. With that, let's open it up to any questions that you may have. Bob has a question here in the room, so we'll go to Bob first.
Governor Bob Mercer, Keloland. What kind of expenses can counties and cities claim beyond just testing?
Yeah, what we told them to start tracking is any costs they may have had for COVID-19, so such as purchasing personal protective equipment, if they had testing supplies, if they had to put in mitigation measures such as barriers, if they had EMS, emergency medical response services that they had to deploy and incurred costs because of that. And then if they had to take some proactive measures to make sure that they were implementing technology to provide telemedicine, or also making sure that they were protecting, bringing people back to work with some mitigation measures going forward. So I laid out some basics. We answered some of their questions, and then Liza will be giving them more information here with her calls to those that track those expenses. And again, Treasury is still writing some guidance on all of this, so it could become more flexible. As of today, we do not have the ability to use these funds for revenue loss, which means cities that would like to do that as well can't. And so we're continuing to talk to our federal delegation and the White House about how important it is to build in that flexibility in the coming days. Yes, Patrick.
Hi, this is Ariel with the Rapid City Journal.
Ariel, I've got Patrick in the room that's going to ask a question, and then I'll come to you.
President Trump today announced some aid for farmers and ranchers specific to the beef industry. Can you follow up on that and update us on any related to the work going on here in South Dakota, particularly meat inspection?
Yes, there is. President Trump had made an announcement today in partnership with USDA Secretary Sonny Perdue, and Ivanka Trump is involved as well, with some aid to producers and some actions that they're taking as a federal government. So that's welcome news. I know agriculture has been hit hard by what's been going on in this country, in particular to the supply chain. And so I think they're hoping to utilize some of that oversupply that hasn't been able to get to folks in need and get it out quickly. So that is something we'll be tracking and working with our federal delegation to make sure that South Dakota is a part of. One of the other follow-up questions was on meatpacking inspections. And one of the things I've asked our congressional delegation to help us with and reached out to the White House on is giving us the ability to sell meat that has been processed in a state-inspected facility, the ability to sell that across a state line. Today we can't do that based on some of the federal requirements, and we can only sell meat across state lines that has been processed in a USDA federally inspected facility. I'd like some flexibility through an executive order or through statute to also utilize some of the facilities that are state inspected to be marketed nationwide, especially in light of the high costs we're seeing in the meat industry today. Ariel, go ahead.
Hi, this is for Secretary Malcolm Wrightson. So today in Rapid City, the Cornerstone Women and Children Shelter confirmed that a adult resident there tested positive. Her and her children have been moved to safe housing, and there's been cleaning, but the director wants to know if the Department of Health, which she said has already contacted them, if they can conduct mass testing at that specific shelter, since it is a group living situation for the residents and staff. And so that's the first question. And then also is, will there be plans to mass test other people in shelters?
Well, thank you, Ariel. Folks that are living in congregate large settings like you've described would be part of our mass testing plan. If we're seeing, activity, positive cases in those kinds of places, then we would certainly want to talk with the folks running that place to see if mass testing is appropriate. We are intending to get to those types of settings as part of our overall mass testing plan, but if they've got some positive cases, then we would want to talk to them about that situation and see if it's the right time to start right now.
Okay, thank you.
A question for Governor Noem. Sam Wright from Dakota News Now.
Sure, go ahead, Sam.
Governor Noem, the CARE app that I believe was kind of introduced at the beginning of this, we were wondering how it's helped so far in handling this virus, and what you might say as well to claim from ACLU that it might be a little bit intrusive.
Are you talking about the CARE app?
Yes.
Yes. It's a tool that we deployed across the state and let people voluntarily utilize if they would like to start tracing where they would go and where they would travel to. And then at a time, sometime in the future, if they did test positive, they would then decide if they wanted to turn that information over to help us do some of the historical contact tracing that we would need to make sure that we could let those folks know that may have been exposed to the virus, that the potential was there. So, that is something that we made available to the people of South Dakota and that many have participated in downloading, and we'll continue to make it available to those that would like to do that.
Benjamin Chase with the Plainsman in Huron.
We're going to go to Casey in the room here, and then we'll go to the phone.
Can you discuss the status of the clinical trial involving, I can't pronounce the word properly, hydroxychloroquine or whatever it is. Could you discuss the status of that here in South Dakota?
Well, the drug trial that is being conducted in the state of South Dakota with hydroxychloroquine is underway. Sanford is leading that through their research arm, but we also have Avera and Monument have agreed to participate as well, which I think is pretty remarkable that we have three hospital healthcare systems that are partnering in a way such as this. They are doing two different registries, which I can have Kim give you some more details on if you'd like to, but they're up and ongoing, and people can voluntarily participate if they'd like to, but certainly is not mandatory, and anybody who would like to participate would do that through contacting their doctor and working with them to see if it's appropriate. Mm-hmm.
And could she?
Yep. Do you want to? Sure.
So in addition to the clinical trial that's geared towards people that do not have COVID, there are two registries that are part of this study as well. One of those registries is for people that are positive with COVID who are prescribed hydroxychloroquine by their provider. And so that registry is intended to see and track over time how that group of people do and to see if there's anything that we can glean from that kind of data. The second registry is for people that are COVID positive who don't necessarily take the hydroxychloroquine, but for greater research purposes so that we in South Dakota can see over the course of time about how they do. So two registries and one clinical trial are underway.
Do you have any idea how long this would take?
Sure. So we expect to have the first tranche of data from the registries in September. And so we'll have a clinical team from across the systems looking at that, seeing what we can learn about what's maybe working better and what's maybe not working as well for folks with COVID, and what, hopefully that will help us contribute to the science of this disease.
Was there a question on the phone?
Yes, Governor Ben Chase with the Plainsman in Huron.
Sure, go ahead, Ben.
We have doubled our cases in the past week, and the Plainsman has confirmed that there are positive cases both at LSI, just outside of Beetle County, and then at Dakota Provisions here within Beetle County. Are there any intentions to do any mass testing at either facility?
So this is Kim Malsom-Risden. When we see cases that are associated with workplaces, that doesn't mean that the person actually got COVID at that workplace, but it could have been a place of transmission. We do reach out to those employers, and we have a team that can come on site if the employer wants. But we have some assessments that we can do with them, even over the phone, to determine are there some changes that they can make that can help with the COVID situation. Mass testing can be an option for critical infrastructure employees, and we are working with some employers that are interested in doing that. It really just depends on the number of cases, kind of the situation around those cases. Remember, just because we've got employees that are positive doesn't mean that the positive COVID cases related to the employment setting. But nevertheless, mass testing is available in situations where we've got critical infrastructure employees, and it seems that the place of employment would be a good place to find out more. So definitely an option, and we work with those employers on a case-by-case basis. And I'll just do a shout-out to employers across the state. They've been great to work with. By and large, they just want to do the right thing, and we've been able to help them with PPE when that's necessary. And as far as I can tell, we're getting good progress from employers across the state.
is Morgan at the Rapid City Journal.
Sure, go ahead, Morgan.
Is any of the state's $1.25 billion in funding supposed to go directly to tribes?
The tribes do have separate funding that was made available to them through legislation. The $1.25 billion, the guidance is very clear that it is allocated to the state of South Dakota. And so then we're looking at other jurisdictions that would be eligible to have some of their costs reimbursed. But the tribes were specifically singled out with other funding sources as well that they have coming to them. And I could follow up and let you know if they've already received some of that.
Yeah, that'd be helpful.
You
And then
bet.
too, I wanted to ask if any of the funding could go to like helping students pay for like internet access at home or that kind of thing.
Well, the education department did get separate funding as well that would help facilitate some of the remote learning that's going on in the state of South Dakota. So the K-12 education system was eligible for separate funding, as was higher education. So those are all areas that we're looking at because some school districts in the state didn't have the ability to utilize internet access where it wasn't available. So that is definitely infrastructure that we're looking at to see if we need to fill that need.
Okay, and then I had a third question for you and
Sure.
Secretary Malcolm Reisen too. Trump said yesterday that he's taking hydroxychloroquine. I don't know, is that something that's advisable? Would you take it if you were exposed or?
Oh, I think everybody, works with their doctor to decide what to do. I don't know if Kim has more feedback. No, that's usually an individual decision somebody makes with their doctor.
Okay, thanks.
Governor JP from
Governor,
KON.
this is Stephen Gross, maybe.
Okay, let's go to JP and then Stephen.
Thank you. Governor, can you give us an update on negotiations regarding the checkpoints at the reservation borders?
Yeah, we're continuing to have communications and work, and we will keep that process in place. There's been no resolution as of today.
Thank you.
Okay, go ahead, Stephen.
I'll just follow up to that.
Mm-hmm.
Are there still plans to file a lawsuit if checkpoints are removed from federal and state highways?
I think that we are continuing to work avenues of having conversations and feedback with the tribes on what would be workable, and we're looking for clarity in the law. So that is the type of action that you'll continue to see us take, and there is no plans today or in the near future to file a lawsuit, although we are taking legal action.
As far as looking for clarity, would a lawsuit be necessary to do that, or how would you get clarity in the law with that?
We'll keep you informed as to what the decisions are. We're trying to make the best decisions for coming to a resolution in partnership between the tribes and the state. We did, if you remember, Stephen, present them with a plan that they haven't responded to. So they didn't reject it. They didn't accept it either. So we're still waiting for feedback from the tribes, and I think that'd be a fantastic question to ask them, is what they think of that plan and if it's workable for them, because it clearly gave them a roadmap to still maintaining checkpoints, but doing it in a manner that it is facilitated on ground that they have authority over. Is there any other further questions?
Governor Mike Tanner from KWAT Watertown.
Sure, go ahead, Mike.
Hi, Governor. It looks like the latest modeling information that was put out was back on April 28th, if I have my information correct, and at that time it looked like the peak would call for 2,200 COVID-19 beds needed in the state. That information is almost a month old now. I'm wondering if you expect any new modeling information to come out, and based on the trends that you've seen since the last model came out, what the next one could possibly look like.
Well, the trends that we're seeing are fantastic. I think that while we still hate to see new hospitalizations, we hate to see tragedy affect any family by a loss of life, we do know that we're far below what our projections were, and that's a good thing for our state. So we don't have plans right now to redo the modeling. The modeling was put in place in order to plan for hospital beds and for planning for ICU beds and using vents. We do have that capacity in the system, and we're doing well. And so our plan is to make sure that we're prepared, which we adequately are, and we'll continue to go forward and take care of people. You know, at this point in time, we were supposed to be escalating and would be seeing our peak in a matter of weeks, and we're far below that, and I think that should be encouraging to everybody.
Thank you.
You bet. Thanks, Mike.
Governor Noem, Sam Wright again, just quick
Sure.
Follow-up question regarding the CARE app, and it might be for Ms. Rystrom. We're just wondering, has the CARE app provided any helpful information to counteract some of this, or has it been very useful up to this point?
We have not had a person that has tested positive that has used the Care-19 app with the location services. And so we're waiting for that to happen. We know it'll be helpful when that person does have that information available to them, and we'll be sure to provide an update when that's the case.
Okay. Thanks, everybody.
Governor Noem.
Oh, one more question?
Can I get one
Go ahead.
question in?
Sure.
Hi, Jeff Bannon, Associated Press, Minneapolis, Governor. Tomorrow is going to be Worker Appreciation Day for the Smithfield workers in Sioux Falls, and I'm wondering if you plan any statement on their behalf or anything to show support for the workers there who have since returned to work. Thank you.
Yeah, we sure can. You know, the city of Sioux Falls is organizing that, and I think it's wonderful that they're doing so. And we certainly thank them for their work and their dedication to providing for our nation's food supply. So just grateful for them, as I am all the people in this state that step up every day and do important work to take care of our families and keep this the best state in the nation. So thank you for that. All right, have a great day.